Ladies and gentlemen, welcome and thank you for joining today's webinar titled Training for Veterinary Services, Antibiotic Use Beef Questionnaire. Please note that this is an interactive webinar and all audio connections are presently muted. Pressing star 6 on your telephone keypad will unmute your line. Star 6 also serves to remute your line. To minimize background noise, please mute your line when you are not speaking. You are welcome to submit written questions throughout the presentation, and these will be addressed during Q&A. Please use the Notes tab on the bottom right-hand side of your screen and address your question to all moderators. If you require technical assistance, please send a note to the ATT CES operator. With that, I will turn the call over to Dr. Kathy Bjork, Study Lead for Antimicrobial Use. Please go ahead.
Good morning. This is Kathy. I just want to thank you for joining us this morning as we go through this training materials for data collection on cattle feedlots for our 2017 antimicrobial use study. This is a very important study for VS. If Dr. McCluskey was with us, as we had hoped, he was called away. He, I think, would express to you the importance of this in antimicrobial resistance studies, that it is an important initiative for veterinary services. And as we go through this webinar today, we'll describe for you why this is important and how it connects with USDA's action plans and other studies. So at this point, what I think I'd like to do is just go around the room here and let you know who's in the room with me, so that if you have questions, there are people here who can answer them fairly quickly. Abby, would you like to just introduce yourself real quick?
Oh, sure. Good morning, everybody. This is Abby Zaire. I'm the field liaison during NAHMS studies, and so I'm available here. If you have any questions, you can just shoot me a note, and I'll help you out. So, Chuck, you're up.
This is Chuck Hosper. I'm a veterinary epidemiologist at the NAHMS unit.
And Chuck is our lead for beef.
Yeah, I've taken over for Dave Dargett as Beef Commodity Specialist.
Hi, everybody. This is Bill Kelly. I'm the PCI team lead for the NAHMS group.
And you'll be hearing from Bill, because he will be doing the 60 training portion of this training. So one thing we do want to make sure that we answer all of your questions. As Tanya said, this is an interactive session, and we've set this up so that if you have questions and concerns or anything, that you can unmute your line and bring those questions to the forefront, not saving things to the end. We know this is a fairly long questionnaire and it's kind of detailed, but we've accomplished these types of studies before, and so we do have precedent for having successfully done antimicrobial use studies or antimicrobial use data collection through some of our earlier national studies. So I'm just going to get started with our training here. We're hoping Dr. McCluskey will join us sometime soon, and if you have any questions for him, maybe you can get those answered then. So today's training, though, the overview and purpose for this training is to provide guidance for the antimicrobial use survey data collection that we are doing. We will go over the study objectives, how they relate to the Antimicrobial Resistance Action Plan, and the U.S. Food and Drug Administration regulatory changes. As I said, we'll talk about the CIPSEA portion of this, data handling and protection for information, and then we'll go into the portion for completing the survey. So for best results for this training, the Catalan Feed 2017 Antimicrobial Use Survey is available, and you should have that maybe on hand. We also have a survey manual that we will be referring to a good deal during this training, And then there's a confidentiality pledge. So those are the ones that are probably the most important for you to have. So for those with access, those versions are available electronically on SharePoint. And I think maybe we'll just kind of wait maybe 10 seconds or so here. If anyone needs to gather those materials together, we'll wait and let you do that. I think I'll just kind of pause for a few seconds for folks to get those materials. Okay, so we'll start with our background and purpose, and this work relates to the USDA Antimicrobial Resistance Action Plan. For some of you who might have been on last week's V-Science webinar, this will look very familiar because this is similar to what we presented last week. Antimicrobial resistance is considered a serious health threat to animals and humans, and there is a concern that disease-causing bacteria in people and animals are developing more resistance to the antibiotics that are needed for treatment. There is a belief that the use of antimicrobial drugs in agriculture is a driver for the emergence and transmission of resistance. But in reality, our understanding of the factors that contribute to AMR and the role of use in agriculture in selecting for resistant bacteria is not complete. And so the work that we're doing now, the information from these on-farm use surveys, will aid in monitoring trends and will help us examine the role of antimicrobial use in resistance as we go down the road into other studies. Just briefly going over the roles of FDA and VS, the U.S. Food and Drug Administration Center for Veterinary Medicine is the regulatory agency for antimicrobials in animals, and they enforce their regulatory position through approvals and labeling. On January 1st, 2017, FDA implemented changes to antimicrobial uses in food animals, and information about this change, the change from over-the-counter use and to veterinary feed directive or prescription uses, the removal of growth promotion uses, all for medically important antibiotics. That information is available at the FDA website. I also, if you're interested and you have access to it, in the V-Science webinar last week, we gave a pretty thorough overview of FDA's changes, how they evolved, when they began, and so if you would like to revisit that webinar, that might give you some information as you're out in the field talking with producers. Also, the animal drugs at FDA website is helpful for doing searches on the implementation of the veterinary feed directive. So APHIS Veterinary Services collaborates with FDA CVM to monitor antimicrobial use in food-producing animals. USDA does not have regulatory authority for antimicrobial use. We are objective in this. We work with stakeholders in industry, advocacy groups, and a number of other groups, including other government agencies, to try and evaluate what is happening with antimicrobial use in agriculture, but we do not collect these data for regulatory purposes. And in doing that, we have the veterinary service does have a trusted relationship with industry to gather and report data, and we share the data only in the aggregate at the regional and national level via publicly available publications. Those publications are available on our NAHMS website, and those are in the form of information sheets or publications in journals and in descriptive reports. And I would encourage you, if you have questions about antimicrobial use in any commodity, to contact us at NAHMS, and we can help point you to that information, or to search on the website, because we have collected these data over probably the last 20 years. If you look back at our studies, you'll see the antimicrobial use data that's been collected and reported. That data has been collected and reported by the National Animal Health Monitoring System. We are part of the Center for Epidemiology and Animal Health in Fort Collins, Colorado. And NAHMS conducts periodic studies of livestock, poultry, and aquaculture commodities. We conduct surveys of farm and production management and animal health. These are run every 5 to 10 years, depending on the commodity. And I would suspect that most of you on the call have participated in one of these studies, if not most of these studies in the past. And so you probably have that field experience already of participating in a NAHMS study. When we conduct these studies, we go through a fairly rigorous process. We work with our collaborators and stakeholders to develop the needs assessment, what information is desired and needed by our stakeholders. And our main stakeholders in many of these are industry and producers. We have some academic researchers that we respond to, and then we have other governmental agencies. The 2017 antimicrobial use surveys, these are a new data collection initiative under the NAHMS umbrella. We are conducting these in swine and feedlot cattle, and these are the first studies that are dedicated solely to addressing antimicrobial use in food-producing animals. We ensure data confidentiality and protection via our CIPSEA status, and I'm going to turn this over to Bill Kelly now. He is our lead for our program implementation and our CIPSEA guidance, so he'll speak with you now about CIPSEA.
Thanks, Kathy. As Kathy mentioned, wanted to spend a little bit of time sort of talking about CIPSEA implementation. And first of all, I just sort of wanted to start off and answer maybe a question about why we're using CIPSEA and why VS is doing the collection on that. So addressing why CIPSEA, antimicrobial use information is very sensitive, and producers are reluctant to share that information. The guarantees that we can provide through CIPSEA provide producers a level of comfort, we hope, with sharing that information, and it's a significant selling point to try and get producers to participate in the study. Why VS? These studies are focusing on specific products and antimicrobial ingredients, and it requires a significant technical level to be able to implement effectively. VS management has decided that our field staff are the best resources to do this work rather than trying to train up NAS enumerators or get third-party individuals in to do that. So it does create some challenges for us compared to a typical NAHMS study, but I'm confident that we're all going to be able to make this work and make it work effectively. At this point, everyone either has or soon will be completing their CIPSEA training, so I'm not going to spend a whole lot of time going over what you're going to learn in the training. I just want to hit a few highlights. First of all, CIPSEA, anybody who's going to have anything to do with any of the data or information has to have the CIPSEA training and the NAS agreement signed and in place prior to accessing that information. Second, we are pledging to the participants to keep their information, including their participation, confidential. The penalties for intentional disclosure are levied against individuals. It's not, these aren't things that the organization takes. It's going to be things that each one of us would take for intentional disclosure. So it's serious. 4, the ultimate goal behind all of this is to make participants comfortable enough to provide the information we need to develop the best quality information we can. And It's the whole purpose for putting up with all of these complexities. Next, I want to discuss briefly sort of the data and information security that we need to keep in mind implementing the study. You all, the data collectors, are the foundation for our information security, and we realize we're asking a lot from you. But what we want to really do is make sure we keep things safe and secure. So keep any files, papers, notes, directions to operations, anything associated with the study, keep it safe. Don't leave things sitting out where other people can see them. If you can lock things up, lock them up. If you don't have anywhere to lock it up, put it in a drawer. If you don't have a drawer, put it in a box. We just want to make sure that we keep all of this stuff secure and keep it separate from your other VS documents or information. Next, think about how you communicate information regarding this study. Don't send information by email if at all possible. If you do have to send it by email, make sure you encrypt it. Don't have phone conversations discussing sensitive information in public areas. So if you're trying to get directions to somebody else, if you're sitting in the office talking about names and addresses and directions, that's probably not appropriate. So try and find a quiet, secure place to have that conversation over the phone. When you're shipping completed documents, double wrap them. Put them in an envelope and then put them in another envelope when you send it. So think about what happens if the first envelope's breached for something. You don't have, we don't want to have a bunch of filled out questionnaires or other information exposed for folks. So double wrap things. Next, don't put don't put any identifying producer information on either the confidentiality forms or the questionnaires. We have places on everything for the NAHMS ID. That's the only identifier we want on any of our paperwork are the NAHMS IDs. Finally, keep your records until NAHMS contacts you with instructions for destroying them. So we're going to ask folks to hang on to stuff for a while we're getting data squared away, and once we're comfortable that we got everything we need, we will contact you all with the instructions and procedures we want for how all that information is just ultimately destroyed. So this is sort of the key complication for having VS implement a CIPSEA study. The CIPSEA makes no provision for disclosures. When we're wearing our normal regulatory hats, we have requirements on reporting animals that exhibit symptoms for reportable disease. CIPSEA makes no provision for a release of that kind. When we pledge that their information is secure and it won't be released, that's the binding promise we have with them. So you really have to make sure that you are not in a position where you can see animals when you are implementing the survey. My preference would be that you conduct this survey off-site. Realize that may not be feasible in all cases. But if you do have to go on-site, please work with that producer, explain the situation that you can't see any animals, and find out a way to get in there in such a manner that you're not exposed to being able to see anything. I think You explain that to producers that the reason for this is to continue to ensure their participation is kept confidential. I think they'll be accommodating with that. Last bit I'm going to go over with folks is the confidentiality pledge, the paperwork we have to do. So this form is on 2-part carbon paper, and this has got to be the first thing you do, the first official thing you do when you show up and meet with that participant. So before you ask them any questions, anything else related to this survey, you've got to complete this, read through this pledge with the producer and then sign it. Again, remember, the only information that's going to be on here from the producer is their NAHMS ID. I'm not going to read through all of it. You all can do that on your own, but I am going to sort of hit some highlights that I think are important to reinforce when you're going through this. The first part is here in the background. There's 2 key concepts I think we need to convey to producers. The first one is that participation in the survey is 100% voluntary. Even though they've agreed to meet you, if they change their mind, they're free to do so. They can decide to participate or not participate. It's up to them. Second part of that is they can decline to answer any question in the survey, even if they've already agreed to participate. We hope they wouldn't, but that is something that's their option. If there's something they're not comfortable with, they don't have to answer. The next part of this is that their participation is vital. You can't do any of this collection without their participation. So we want to make sure they're comfortable providing the information and just reinforce how important their participation is. The confidentiality section is sort of the meat and potatoes of the whole pledge. Much of this is stuff that you've been exposed to in your training. But one piece I want to point out to folks that you may get some questions on is this piece here that talks about Department of Homeland Security. And basically what it's saying is that Homeland Security monitors all federal government electronic communications. They're monitoring for external breaches, so folks trying to break into federal systems. They also monitor for suspicious internal activities. And while it's not likely, it is possible that Homeland Security would be able to access emails or computers containing producers' information. This is why we want you to encrypt things and limit, whenever possible, how much email you do. The next piece I want to talk about here is regarding the publishing. Regardless of who publishes the findings, the producer information will be aggregated and reviewed by NAHMS staff to ensure that individual producer information is neither released nor can it be inferred from the published results. We've got a bunch of really smart folks here that do a lot of work on all the data we collect to make sure that, A, we don't release anything record level right off the top, but 2, that they can go back and combine data in different ways just to make sure that we can infer who an individual producer was based on what we've already published. So reinforce that when you're talking to them. The last bit here that I wanted to just touch base on was that this pledge is limited to our activities with this producer implementing this study. So if they have any other interactions with VS, This pledge of confidentiality doesn't bind us to that. So if folks are doing movement tests or there's a reported FADD or something like that, this pledge is only good for our activities implementing this survey. Finally, after going through all this, if the producer is still willing to continue, we're going to put their NAHMS ID in the NAHMS ID section, and you, the data collector, is going to sign and date. So after you've done that, please check to make sure that that's gone through both sides of the carbon, and you can see everything clearly on both copies. If it, for some reason, hasn't gone through, just sign the second page like you did the top page. Tear off the top copy and give that to the producer. You keep the yellow sheet, the second copy, and keep that with the questionnaire and ship that together with the completed questionnaire back to the coordinator on whatever schedule, however you guys arrange that in your respective states. It's critical that we have a signed pledge for every questionnaire. If we don't have a pledge for a completed questionnaire, we've got a problem. So really focus on keeping track of those and keeping those together for us. With that, do you have any questions? I did get a question today that I'll address right now. The first part of it was getting the field from a coordinator, getting your field data collectors. Where do the copies of the confidentiality forms go? And I think that's the NAHMS confidentiality form, I believe. So we would like the originals mailed here, or send them to your coordinator and then mail them back here. Next part of the question was, I haven't received any producer data as of yet. And when will we be getting that from NAHMS? We'll send out instructions here later this week on how to get the electronic copies of things. The process was that, as we understood it anyway, that NAHMS would be providing each of the coordinators hard copies of the turnover sheets on 30 May, 23 June, 7 July, and then for states in the upper Midwest, 21st July. That's the procedure as we understand it from NAHMS. There may be a little change on the date. It may not get it to you right on the 23rd, but it should be around the 23rd. We've got a few that we'll be sending out electronically here probably next week. Any other questions?
Yeah, hi Bill, this is Tom Brignoli. How are you doing?
Pretty good. How are you doing, Tom?
All right. You said something about keeping all materials until we're told by CIPSEA, I assume, to either dispose of them or send them on or whatever. In this study, what materials are we talking about? I assume we just get the confidentiality pledge and the questionnaire and forward that up the line.
Yeah, that's correct, Tom. But all of your tracking information, participant name, address, all of that information, any other notes, files,
Okay.
Anything else that you have that's not a questionnaire or a confidentiality pledge?
Okay, you're talking about the working documents that we use
Yes.
to kind of manage the thing. Okay, got it. Thanks.
Any other questions? Okay, with that, I'm going to turn it back over to Kathy, and we'll continue on.
Okay.
Kathy?
Thanks, Bill.
Thanks, Bill. I believe Bill will stay in the room with us.
I will.
For the full training. In case you have any questions as we go through the questionnaire, please bring them up to Bill, Chuck, Abby, anyone, and don't hesitate, because we do want to make sure that you have the information that you need.